My name is Addison Jones, and today I'll be discussing the blood flow throughout the heart, as well as the electrical conduction system of the heart. Beginning with blood flow, deoxygenated blood will enter the heart from the body via the superior vena cava, the inferior vena cava, as well as the coronary sinus, and enter into the right atrium. After entering the right atrium, the deoxygenated blood will go through the tricuspid valve, which contains 3 cusps called the anterior, posterior, and septal, and go into the right ventricle. Then the blood will enter the pulmonic valve, which contains 3 cusps called the anterior, left, and right cusp, go through the main pulmonary artery, the right pulmonary artery, and the left pulmonary artery. And after going through the pulmonary artery, will go to the lungs to be oxygenated. After the blood is oxygenated, it will enter back into the heart via the pulmonary veins. There are right and left pulmonary veins. Once going through the pulmonary veins, the oxygenated blood will enter back into the heart in the left atrium. After entering the left atrium, the oxygenated blood will go through the mitral valve, which contain 2 cusps called the anterior and posterior cusp, and go into the left ventricle. After entering the left ventricle, the oxygenated blood will enter the aortic valve, which has 3 cusps called the left, right, and non-coronary cusp, and transfer through the aorta. Once in the aorta, it will go throughout the aortic branches called the brachiocephalic, left common carotid, and left subclavian, and transfer to the rest of the body as oxygenated blood. Next, we will talk about the electrical conduction system of the heart. The sinoatrial node, also called the SA node, will signal atrial contraction. After this, a message will be sent to the atrioventricular node, also called the AV node, which will then send a signal to the bundle of His. The bundle of His will transmit messages to the right and the left bundle branches, which contain Purkinje fibers. The Purkinje fibers will then signal ventricular contraction.